Hello and welcome to my second presentation on the respiratory system. I'm going to go over ARDS. Now ARDS can be caused by many things. It's a very, very serious condition, and trauma, sepsis, shock, acute pancreatitis, those are just some of the causes of ARDS. Basically, the alveoli are damaged, and that increases the alveolar capillary permeability, which causes a protein-filled fluid to fill the alveoli. Gas exchange is thereby impaired, and then there's pulmonary hypertension, and mechanical ventilation is needed. On physical examination, someone with ARDS would have diffuse crackles. It's diagnosed by hypoxemia, and actually the severity of ARDS is determined by the degree of hypoxemia present, and also bilateral alveolar infiltrates. But remember that you need to exclude cardiac etiologies because heart failure can mimic ARDS. And you also need to exclude massive pulmonary embolism by doing an echocardiogram. Mechanical ventilation in ARDS is a very important topic. So ideally, you should deliver low tidal volumes and maintain alveolar hyperventilation. And you do this because low tidal volumes allow for a little bit of hypercapnia, which drives alveoli to ventilate, and you don't want them to collapse. And you increase the PEEP, which keeps oxygenation increased, which keeps the alveoli open. And the respiratory rate and tidal volume are really of no consequence when you're talking about ARDS. Those are really only important in primary disorders. As for the solitary pulmonary nodule, the easiest thing you can do is to find a chest x-ray from a couple of years back with the same appearance, and then you're done. If this is not possible, you perform a chest CT. If the chest CT suggests a benign mass, you're just going to follow up with serial CT scans. If it's intermediate looking, a PET scan or biopsy is what you do. If it's really suspicious, you excise it. And so how something is benign is if there are popcorn calcifications, if they're concentric, but if they are spiculated, that suggests something that's more malignant. And that ends my second lecture on the respiratory system.